Hi, I'm Dr. Mukesh Gupta from Lemest, Malad, Mumbai. Understanding the body changes after delivery is what we're going to discuss in this video. Well, what are these body changes which are happening in the body after delivery? Why is it happening? How do I lose my weight? That's the most million-dollar question. How do I get back my shape? Another very important thing. And when do I need to meet a doctor if something goes wrong? We're going to try to discuss this in this video. Well, first of all, the moment you've delivered, remember, your body has undergone plethora of changes for the last 9 months. Your body has actually seen a huge surge of hormones which has changed a lot of your body's functioning and structure during these 9 months. You manufactured a baby, madam. It is going to be a lot of efforts, isn't it? Well, once the baby is out, our body takes its time to come back to its original self. And this coming back time is approximately 5 to 6 weeks, or the classical traditional 1.5 months or 5 weeks that we always talk about. Well, this 6 weeks window is one of the most important phase of your life in the recovery phase of your body. Well, let me run through the changes that we are going to look at. Well, when you look at the mirror, what are the things that are going haywire? From top to bottom, the common complaints that we hear is, my hair is falling, my skin, look at the pigmentation, look at the pimples and acne, I'm looking so much more darker, look the pigmentation here, the breast has become so heavy and oversized, will I ever be able to get back in my original shape? Your body fat, your excessive stretch marks all over the body, your abdomen has become lax and loose, your back is paining, your thighs are heavy, everything has gone haywire. Another very important that you are worried about is your perineum and the laxity of the lower part of your body and other aspects which are troubling you. Well, there's lots of things happening. Besides this, the aches and pains, the muscle pain which is going through your body, the uterine after pains, after delivery, the uterus which was so huge is now starting to contract and retract and started going down. And this actually at the time of delivery reaches up to the umbilicus. But after the delivery, it has to go down, say approximately 1 to 2 centimeter per day, and then it goes back to original size. This is called as involution. Well, by 6 weeks, it is going to go back to its original size. Till that time, it is going to contract and retract, contract and retract. And every time it contracts and retracts, you may get the pain, which is similar to the labor pain. Not as much as that, but much lesser. But yes, it is there. Classically, the woman would say, I'm breastfeeding my baby, and when I'm feeding the child, I feel some pain in my abdomen. It is so bad, I am finding it difficult. Well, when you breastfeed the baby is actually stimulating your brain to produce a hormone called as oxytocin, which is helping in releasing of the milk from the breast muscles and glands. And that contraction of the muscle actually, from which is around the gland, helps in pushing the milk out. That same oxytocin is acting on your uterus to help it contract and involute. And that is the reason why you feel the pain when you breastfeed the baby sometimes. Well, don't worry about it. It's just temporary and actually good for your body because it reduces your bleeding. And that's a very important thing. Another big problem that we are bothered about is the discharge from the private part. There's a lot of discharge which is called as lochia. Initially, it is reddish discharge, and then it becomes reddish and whitish, and then pinkish rather, and then it becomes white, and then it stops. Again, it takes 6 weeks for it to resolve almost completely. Sometimes it takes around a couple of months for it to come down. Next important thing is, how do I care for my body during this time? Well, this hair fall, skin care are the most important thing that we are worried about. But more than that, our bigger worry is how to take care of your breast and milk and our perineum for that matter, the wound, if whether it is a cesarean section or a normal delivery, how to take care of the wound so that it doesn't get infected. That's our focus. Eat good food, healthy diet, good minerals, vitamins, have lots of fibers. Constipation is another problem post-delivery. Lastly, most important thing is that take care of your perineal wound or the cesarean section wound. If you have any doubt of infection, immediately report to the doctor. Now, what are the various different other aspects which are coming into the play? Suddenly there's a lot of bloating which is seen, or swelling in the legs. Doctor, I have delivered the baby, but my swelling has not gone yet. Well, sometimes the swelling in the leg takes a little longer time, maybe a week or two, for it to come down. Patients come and say, I feel like passing a lot of urine. Well, your cardiovascular system at the time of delivery was overburdened with extra fluid and blood volume. Now it is going back to its original size and it is pushing that extra fluid out of the body for it to be excreted. And this is what is going to happen. We call it phase of diuresis. Suddenly the woman will say, I'm having a lot of urination, doctor. Well, it is good for you. It is good for you because the fluid which was extra and surplus is coming out. It is good for you because it is reducing your chances of urinary infection. Well, that brings me to an important point. Have lots of fluid orally during the pregnancy, post-delivery. Because if you do not have lots of fluid post-delivery, your chances of urinary infection is very high. So have lots of fluid. Take care of your perineum. Keep it clean, wash it dry, wipe it dry. Because if you keep it moist, the chances of infection are very high down there. Another thing that we are worried about post-delivery is how do we lose our weight? Well, surprisingly, but the most important way to lose your weight is, yes, breastfeeding. You're feeding a baby and the baby takes away lots of your calories, and immediately the body is your body has stored the fat because it wants to supply nutrition to you and your baby. So the moment the baby is out and you're feeding the baby, that fat is being utilized to give nutrition to your baby. And that's a very good way to lose your weight. But the problem is when you're feeding the baby at one end, at other end, you're dumping in a lot of high calorie food in your body thinking that, oh, I need to eat more, eat more, eat more. Well, there has to be a balance. You need to eat smart, not more. Eat good, but not double the amount. So you need to eat well so that you don't lose up on your chance of losing your weight, and at the same time, do not lose up on your chance of feeding your child with good nutritious milk. So this is a balance which you have to take care. Meet a good nutritionist and they will advise you on tips on how to take care of that. Next is how to get back in shape. Because your breast tissue, your lax abdomen, your hips, your thighs, everything is dangling, and what should we do? Tying off an abdominal binder or wearing a corset is not the best example of losing your weight and getting into shape. Well, it is a temporary thing, and if it makes you feel good, please do that. And if your abdomen is very loose, if you wear a corset or a binder, it will help you to support that lax abdomen for some time till you get shaped up. There is only one way that you can shape up, and that is by toning up and exercising. That is the easiest way, trust me, not the difficult way. Regularly exercise, work on your various body parts, work on your abs, work on your hips and thighs, work on your upper body. When do we start the exercising? Well, heavy exercising and regular exercising can be started after 1.5 to 2 months of your delivery, not before that. The moment you've finished with your 1.5 months of break, you can start doing regular walks and regular, strolls around, and then gradually build it up with functional training and then weights. And take it stepwise. Go slow with your body. Don't push your body from day one. That'll be a better idea. What about the perineal part, the private parts? Anything that can be done for that? Well, Kegels exercise. The golden word is Kegels. You need to regularly do these exercises, which will help you tone up your pelvic muscles, increase the circulation there, help you in healing of that part, help you in involution of that part. The tightening of the muscles will reduce your chances of urinary incontinence when you cough or lift weight and the urine leaks out. That will not happen. It will prevent your uterus from slipping down. We call it prolapse of uterus. That will also not happen. And of course, your personal sexual life will also improve because of the tone becoming better and better. So these are the few basic changes that we are looking at. Last but not the least, remember, pregnancy is an amazing time when your body has made these adaptations for your baby. If you take care of your body, you may go back to the original size and shape, and maybe a little better than what you were earlier. Thank you so much.